When you're considering a vaccination program in your horse, it's a very good resource is the AAEP, American Association of Equine Practitioners. They have vaccination guidelines that are available to you on the web that talk about all the diseases and how often horses should be vaccinated with respect to these environmental diseases like tetanus, rabies, and the vector-borne encephalitis diseases that we're going to talk about. Vector-borne diseases, mosquito-borne in the case of most of these diseases, whether it's West Nile, Eastern encephalitis, or Western encephalitis, or Venezuelan encephalitis, are all transmitted by mosquitoes. And birds are the reservoir, and they amplify the virus in the environment. Mosquito bites bird, then bites horse, horse gets encephalitis. Encephalitis is very, very serious. Many times it's life-threatening. Horses traumatize themselves, they may be blind, they run into things, and certainly treating horses with these encephalitides is not something you want to even try to have to do. You could spend $10,000 treating a horse with encephalitis and then have a horse that is no longer living. And vaccination from an economic standpoint is a no-brainer. Depending on where you are in the United States determines what sort of encephalitides that horses will get. Eastern encephalitis, as the name says, is mostly in the eastern United States. This is very devastating. Horses that get this disease, it's pretty much 100% fatal. The scary thing, we're seeing Eastern encephalitis farther west in the United States as time has gone on. What we try to do is time and do a strategic approach to vaccination, where we choose times of the year when we have mosquito activity. In certain areas of the United States, we have snow on the ground and less mosquito activity, and many horses can get away with once-a-year boosters for those particular viruses. Your best bet on advice when vaccinating your horse, depending on where you are, is your local veterinarian. They know, A, what you expect to do with your horse, how you travel with your horse. If you go to south in the wintertime, that horse needs a different vaccination program than a horse that lives in northern tier states. And your best bet is to discuss that with your veterinarian. I'm Dr. Rob Keene, and together with your veterinarian, we can master equine health.